Around 250 cases of measles have been reported across the U.S. so far this year. On this map, you see all the states where those measles cases are. Well, just this week, North Carolina joined that list after one child tested positive in the Charlotte area. WRAL health reporter Grace Haba examines the threat a measles outbreak poses in the Triangle and how many children could be at risk.
Measles. It's one of the most contagious diseases in the world.
If you're susceptible and you're in the room with somebody who has measles, you have a very high likelihood, like 95+% chance of catching it.
At the same time, it's also one of the most preventable.
We've had measles vaccine for, more than 40 years. It's not a new vaccine. Hundreds of millions of people have received it.
But doctors say lower vaccination rates during and since COVID has caused a potentially damaging ripple effect on those most likely to catch it. Kids. Measles is a required vaccination for students in North Carolina, but the latest data shows thousands could be unprotected. Only about 93% of kindergartners across the state were up to date on all required vaccinations at the start of last school year. Wake and Durham counties specifically were even worse off at 92%. That means about 9,000 kindergartners statewide, roughly 850 of which are in Wake County and 180 in Durham, could be at risk.
Quite concerning, because we know that really to prevent measles transmission in the community, we need to be at 95% or better. Having kids who are in close contact with one another and a highly contagious virus, the likelihood of spread becomes that much greater.
Out of the roughly 250 cases nationwide, the CDC reports 105 people were hospitalized, 83% of whom were children or teens. Grace Haba, WRAL News.